Hi everyone, thank you for joining me. It is Sunday, so another episode of Supervision Sundays. Again, I am Dr. Brittany. I am a licensed clinical social worker, an advocate, an educator, and I absolutely love providing individuals who are interested with information about social work practice and how you can be a better clinician. Hence the name Lead Clinically, because I certainly believe that through research, through information, through sharing with others, through supervision, we can improve the practice that we provide to our clients. And so if you're not already following me on Facebook, on Twitter, on Instagram, super simple, please hashtag Supervision Sundays, but also at Lead Clinically so that you can get information and updates. Again, I love you all's feedback. So if there's anything that you all are interested in and questions you have, share that with me. Again, Instagram, Twitter, Facebook, super simple. It's the same thing on any social media platform. It's at Lead Clinically. So let's get right into it. This week's topic is on your responsibility as a clinician as it relates to the disclosure of confidential information, specifically related to HIV. So this topic actually came up in one of the classes that I teach and with some of the interns I work with during supervision recently. And what I think is important about this topic is that we always talk about HIPAA, right? We get training on HIPAA. Most agencies are very clear about HIPAA, so we know we need a release, we need signed consents to talk to another agency or to coordinate care with someone. And we also know that if we are going to break confidentiality, we know, hey, we have to tell our clients if you're thinking about hurting yourself, if you're thinking about hurting someone else, if you are reporting the abuse of a vulnerable child or adult, we are mandated reporters, right? But I think what's missing in that conversation is, say that hypothetically you are in a situation where you're providing therapy to an individual who you know has disclosed that they are HIV positive and that they may be spreading that to their partner, and their partner is unaware that that individual is HIV positive. And so first and foremost, I always try to give you all resources and tell you where I'm getting my information from. So I want to provide you with, number one, how you can get more information about this topic, specifically going over to the Florida Board of Clinical Social Work, Marriage and Family Therapy and Mental Health Counseling. You want to go to their board website and look at what it says. And so I'll provide you those resources. So if you look at the Florida Board website, it automatically refers you over to the Florida statutes, right? And when you look at the statute, what you'll find is that we are not considered mandated reporters when it relates to HIV. And so if you read the statute specifically, it gives you the conditions upon which you can release that information. And so first I want to give you those, the criteria for releasing the information, but I also want us to have a conversation about what that actually looks like in clinical practice. And so one is that the individual you're seeing has to disclose to you, and this is the first, has to disclose to you the identity of the individual, the partner. And so that can be very tricky, right? When we think about our clients, I know for me, most of the times I know the first name of my clients' partners, but I typically don't know their first and last name or how to contact them. And so the statute is very clear. It does say that the individual has to first provide you the identity of the individual that they are having sex with, or maybe it's a needle sharing partner. They have to disclose the identity to you. It does not say that you, doesn't permit you to go on Facebook or to go looking up the information. That individual that you're seeing has to give you the information. The second thing that the statute shares with you is that you then have to make sure that you talk with your client about the importance of not transmitting they're not continuing to engage in behavior that could lead to the transmission of HIV. Additionally, the individual has to then be asked to stop engaging in that behavior, and then the individual has to refuse. And so that's important, right? Because if you say, hey, client A, I noticed that you're sharing this information with me, it's very important that you don't continue to engage in needle sharing, knowing your positive status, but the person has to to then say to you, I'm unwilling to do that. And so again, if you're seeing a client and they say that kind of says, okay, well, then I can look back at the statutes. But if the client is saying, I'm absolutely agreeable to what you're saying, then there's no obligation, there's no requirement through the statutes that you continue any further, again, because this statute is saying this is the conditions upon which you can release the information. So again, you're allowed to release the information if, one, you know the identity through that individual you're seeing, that individual has shared the information with you, but then two, you talk with them about managing so that we're not transmitting, and then also you've asked them to refrain from that behavior and they're actually refusing. And so that can be very tricky because your client may say yes, but then may leave session and not follow through, right? But there's nothing in the statute, that part is unclear. It says the individual has to refuse. And so that brings up the importance of documentation, right? Is that after that session, you're documenting in a way that, let's just say you are choosing to notify someone, that you have documented, you follow what the statute has said. Now, what's interesting is that the statute says that you cannot be civilly or criminally liable for disclosing it. However, the statute doesn't say that we are mandated reporters as clinicians. The statute gives you the permissions for how you can disclose the information and under what circumstances, but it also says that you're not civilly or criminally liable if you choose not to provide that information, right? And so what comes up is we can have our personal bias, right? I think that the unfortunate part of individuals who are living under an HIV positive status is that there's so much stigma around it. There's so much misinformation. People fear individuals, and that's really unfair to your clients, right? And so they're living out here in the world, and to no consequence of their own, they have a lot of people who do not treat them fairly. And so it's my position that we really look at why it is we're feeling so called to maybe share with that other partner about the positive status. Because oftentimes people are coming into therapy and this is their four walls. This is the only opportunity that they have to really be themselves. And so we are modeling good communication skills. We are modeling good relationship skills. And so while we want to encourage our clients to share their positive status, we also, especially as social workers, are called to be very mindful of the social status and the social stigma that those individuals live under. And so for me, I would always recommend that you work with your client on what the barriers are, but you be mindful of the fact that there are very relevant fears associated with disclosing that. Some people are very nasty. There was a recent news article where someone who worked for the health department was going around posting the positive status of individuals. And could you imagine that individual has now not been able to disclose in a manner that makes them comfortable? And that is unfair to our clients. And so again, we're not mandated reporters when it comes to disclosing a positive HIV status. We're absolutely not that as clinicians. We are only permitted to disclose that if we choose to under certain circumstances, but we can absolutely choose not to. And we can choose not to and choose to support our clients. And so one of the things that also is important is to look at the NASW Code of Ethics, and it calls us to be culturally competent. And so in being culturally competent, that also means that, hey, what is it that individual may be experiencing, and talking with that person about it, and maybe offering, is there a way that I can support you in doing that? And so my personal and professional is that I'm choosing not to disclose that to the partner and to work with my client on getting to a point where they're able to do that. Because again, we're not civilly or criminally liable either way. So it is your choice as a clinician. And so your choice may absolutely be different than my choice as a professional clinician, but you all get to choose that, and you have to choose what type of clinician you will be for your practice. And so I think it's very interesting that the statutes gives us the ability to choose. And so what that means is you can develop your own style, and you can develop what's important to you, right? And so if you decide that it's something that you very much could not sit with and work through with your client, then when you're first meeting them and you're going over limits of confidentiality, you want to give them that information up front. You don't want to wait till 8 sessions in, right? You want to say, hey, here are the limits of confidentiality per HIPAA, but also the Florida statute does permit me to do this, and if this information is shared with me and I am aware of these certain things, I know who the partner is, then I'm very much going to share that information. I will work with you, but this is my own decision that the Florida statute allows me to make as a clinician. So, very interesting topic. I think that it is super open for discussion. So let's keep the discussion going, right? It's like, has this ever been talked to? Have you ever talked about this with anyone else? Has this been brought to your attention? Were you aware? What are your thoughts? What would you do? Let's keep the conversation going in the comments. I absolutely love y'all's feedback, so please share. If you're interested in ways to get involved in the community and you're in the Tampa Bay area, I'm involved in the community through the Pinellas County Urban League, but also I'm aware of Metro Inclusive Health, which does a lot of advocacy, a lot of community outreach around the issue of HIV. And the Pinellas County Health Department, as well as the Hillsborough County Health Department, they do have community groups and listening sessions to support those individuals. And again, I'm an advocate of decreasing the stigma. There's so much misinformation out there that I think that we as clinicians have to educate ourselves and be supportive that there are plenty of individuals out here who can lead very healthy lives, and we should not be the ones to spread misinformation or to increase the stigma around someone who may be living under a positive status. So thank you all for your time. I look forward to seeing what you all think in the comments. Please like, share, and follow.